Section 1. Introduction. Understanding blood pressure. Blood pressure is often described as the silent killer, a vital sign of health that operates quietly behind the scenes. The heart, an incredible muscle, contracts and relaxes rhythmically to pump blood throughout our bodies. This action of pumping blood generates pressure within the blood vessels, which is what we measure as blood pressure. It's an indicator not only of the health of our heart, but also of the arteries and the overall circulatory system. By understanding blood pressure, we can better appreciate how our body functions and the steps we can take to maintain our health. When measured, blood pressure offers a snapshot of your health, providing crucial data that can help prevent severe health complications. Section 2. The beating heart, visualizing blood flow. Imagine your heart, a fist-sized muscle situated in your chest, beating about 70 times per minute. With each beat, it pumps blood, rich in oxygen and nutrients, to every part of your body through a vast network of arteries and veins. The heart consists of 4 chambers, 2 upper chambers called atria, and 2 lower chambers called ventricles. Blood flows from the body into the right atrium, moves to the right ventricle, and is then pumped to the lungs to receive oxygen. This oxygen-rich blood returns to the heart's left atrium, flows into the left ventricle, and is pumped out to the rest of the body. The elasticity of the arteries also plays a crucial role in maintaining proper blood flow and pressure. Understanding how the heart operates and how blood flows is not just academic, it impacts every aspect of our health. Section 3. Defining blood pressure and its measurements. Blood pressure, simply put, is the force exerted by circulating blood on the walls of blood vessels. Typically, blood pressure is measured using a device called a sphygmomanometer, which includes a cuff that inflates around your arm. This measurement yields 2 numbers, crucial for assessing the state of your cardiovascular health. The first number recorded is the systolic pressure, which measures the pressure in your arteries when your heart beats. The second number is the diastolic pressure, which measures the pressure in your arteries when your heart rests between beats. High blood pressure or hypertension is when these numbers are consistently too high, which can strain your heart and damage your blood vessels. Conversely, low blood pressure, while often less concerning, can cause dizziness and fainting, indicating that your brain and other organs might not be getting enough blood. Section 4. Understanding systolic and diastolic pressures. Systolic pressure, the higher of the 2 numbers, indicates the pressure in the arteries when the heart beats. A normal systolic pressure is typically below 120 millimeters of mercury. Diastolic pressure is the pressure in the arteries when the heart is at rest between beats. This number should ideally be less than 80 millimeters of mercury. When the diastolic pressure is high, it can mean the arteries are too rigid and cannot relax properly. Together, these 2 values provide a complete picture of blood pressure health. Consistently high readings of either systolic or diastolic pressure can lead to a diagnosis of hypertension, a major risk factor for heart attacks and strokes. Section 5. The journey of blood flow through heart and vessels. The heart acts as a pump that propels blood through a closed loop of vessels, which includes arteries, veins, and capillaries. Blood enters the heart through the right atrium and flows into the right ventricle, which then pumps it to the lungs via the pulmonary arteries. In the lungs, blood releases carbon dioxide and absorbs oxygen. The oxygen-rich blood returns to the heart's left atrium, then to the left ventricle, which pumps it out through the aorta and arterial system to the rest of the body. After delivering oxygen and nutrients, the blood returns to the heart through the venous system, completing the circuit. The arterial walls are thick and elastic to withstand the high pressure created when the heart pumps blood through them. Understanding this dynamic flow and the mechanisms that control it helps us appreciate the complexities of our cardiovascular system. Section 6. Types of blood pressure: normal, high, and low. Normal blood pressure is when both systolic and diastolic pressures are within the ideal range, below 120 over 80 millimeters of mercury. High blood pressure or hypertension is classified further based on its severity. Stage 1 hypertension is when systolic pressure is between 130 to 139 millimeters of mercury, or diastolic pressure is between 80 to 89 millimeters of mercury. Stage 2 hypertension is more severe, with systolic pressure at 140 millimeters of mercury or higher, or diastolic pressure at 90 millimeters of mercury or higher. Hypertension requires careful management to reduce the risk of cardiovascular complications. Low blood pressure or hypotension is typically less concerning but can cause symptoms like dizziness or fainting if blood flow to the brain is insufficient. It's generally defined as a blood pressure lower than 90/60 millimeters of mercury. Regular monitoring can help detect changes in blood pressure that might require adjustments in lifestyle or medical intervention. Section 7. The dangers of high blood pressure. High blood pressure or hypertension is one of the leading risk factors for heart disease, stroke, and other serious health conditions. When blood pressure is high, the heart must work harder than normal, putting extra strain on the heart and blood vessels. Over time, this increased work can lead to the thickening of the heart muscle, a condition known as hypertrophy, which can reduce the heart's ability to pump blood effectively. Controlling high blood pressure through lifestyle changes and medications can significantly reduce the risk of these severe complications. Section 8. Lifestyle adjustments for blood pressure control. Managing blood pressure is often possible through lifestyle changes, which can help mitigate the need for medication and reduce the risk of cardiovascular disease. Fitness expert, as S3. One of the most effective strategies is regular physical activity. Exercise helps the heart use oxygen more efficiently, so it doesn't work as hard to pump blood. Health experts recommend moderate intensity exercise such as brisk walking for at least 150 minutes per week or vigorous intensity exercise such as running for 75 minutes per week. Another key component is dietary management. Reducing salt intake is crucial because excess salt can cause the body to retain water, which raises blood pressure. A diet rich in fruits, vegetables, whole grains, and low-fat dairy products can help lower blood pressure. Fitness expert, as S3. Limiting alcohol intake and avoiding tobacco products also contributes significantly to lowering blood pressure. Section 9. Eating right. A heart-healthy diet. Eating a diet that supports heart health is crucial for managing blood pressure. The DASH diet, as mentioned, emphasizes vegetables, fruits, whole grains, and low-fat dairy products. Nutritionist, as S4. It also includes meat, fish, poultry, nuts, and beans, and is rich in potassium, magnesium, and calcium. Nutrients that are essential for lowering blood pressure. Reducing the intake of foods high in saturated fats, cholesterol, and trans fats can help reduce plaque buildup in the arteries and lower blood pressure. Portion control is also important. Eating more than the body needs can lead to weight gain, and carrying extra weight strains the heart and can raise blood pressure. Nutritionist, as S4. For instance, incorporating a salad with a variety of vegetables can add fiber and antioxidants, which help regulate blood pressure. Section 10. Exercise and stress management for blood pressure. Regular physical activity is one of the most effective tools in lowering and controlling blood pressure. Fitness expert, as S3. Activities like walking, jogging, cycling, swimming, or even dancing can elevate the heart rate and have long-term benefits for blood pressure and cardiovascular health. For instance, taking a daily 30-minute walk can lower systolic blood pressure by 4 to 9 millimeters of mercury, which can be as effective as some blood pressure medications. Stress management expert, as S5. Stress management is another critical aspect of controlling blood pressure. Techniques like mindfulness meditation, deep breathing exercises, and yoga can reduce stress and have been shown to lower blood pressure. Creating a routine that includes time for relaxation and activities you enjoy can also help manage stress. Fitness expert, as S3. By integrating regular physical activity and effective stress management techniques, individuals can significantly improve their cardiovascular health and reduce their risk of high blood pressure. Section 11. Regular checkups and preventive measures. Regular checkups with a healthcare provider are essential in managing and monitoring blood pressure. Doctor, as S1. During these visits, healthcare providers can offer valuable advice tailored to individual health needs and adjust treatment plans as necessary. Monitoring blood pressure at home with a reliable blood pressure monitor can also be helpful. Patient, as S2. Ultimately, the key to managing blood pressure lies in a proactive approach to health. Understanding the factors that affect blood pressure, actively engaging in preventive lifestyle habits, and maintaining regular communication with healthcare providers are all essential strategies in managing and preventing the complications of high blood pressure.